Donald Trump and RFK Jr. just told the country that acetaminophen causes autism. Their statements are misleading and dangerous.
Effective immediately, the FDA will be notifying physicians that the use of let's see how we say that. Acetaminophen. Is that okay? Which is basically commonly known as Tylenol. So taking Tylenol is not good.
Years ago, a few observational studies saw a weak association between acetaminophen use during pregnancy and neurodevelopmental diagnoses. These were not very high-quality trials, and they were at risk of confounding. What do I mean by confounding? Think for a moment about why a woman might need to take acetaminophen during pregnancy. Maybe she became sick and developed a fever. It's possible that those types of conditions that would lead to acetaminophen use may have also contributed to those differences seen in outcomes, not necessarily the acetaminophen itself. The risk is that you might blame the fire extinguisher for the effects of the fire, but you only reach for the extinguisher once there's already obviously smoke in the air. Of course, it's also possible that the acetaminophen really did contribute. So to better answer the question, researchers really needed a much larger set of data with much higher quality data. In 2024, researchers analyzed 2.4 million birds in Sweden for associations between medicine use during pregnancy and developmental outcomes. And before adjusting for any potential confounding, they did see an apparent uptick in autism and ADHD with reported acetaminophen use. However, when they controlled for other variables like parents' age, smoking status, BMI, income, and other important variables, and then they compared between siblings born to the same parents, they saw zero difference in odds of autism or ADHD based on acetaminophen use. When they looked at those more rigorous data, the signal totally vanished. But even if there's a little bit of uncertainty, which there still is, why not just err on the safe side and avoid acetaminophen altogether? Well, as we discussed before, pregnant women don't just take acetaminophen for fun. It's one of the only safe options to treat fever during pregnancy. And if you're pregnant, this is where you should lock in for what I'm going to say next. Having a fever in pregnancy very clearly increases risk for potentially severely bad outcomes for the embryo or fetus, including a higher risk of neural tube defects and preterm birth. Toughing it out and avoiding acetaminophen altogether is not a neutral option. That's not playing it safe, because the trade-off is that some women will choose to ride out a period of fever which has known clear and causal risks. There's a benefit-risk ratio consideration for all medicines, including during pregnancy, but Trump and RFK Jr. are not capable of rigorously assessing those benefit-risk ratios or communicating scientific evidence. Your doctor, however, is capable, and you should call them if you have infection, pain, or fever while pregnant.